When a woman is pregnant, she is responsible for two lives, like not only hers, but the child that she's carrying as well. And she has to provide safety for that child. And the cultural safety affects her emotions and her mind and probably her physical body. So it affects all of her, and it's going to affect that baby as well as to how she feels.
You're going to carry a life within your being. You're going to carry a child. You're going to go through 9 months of a ceremonial process of bringing a child into this world. And of everything in the womb, you're given the role by Simantu as a woman to carry this life into your being, and this is the passage for your child to be part of this sacred gift of life that we have.
We come from a matrilineal background, and the importance of our women within our communities, and especially around life-giving and carrying a baby. I know from my experience and from my learning and knowledge that that it's important for a woman to be feeling safe, feeling secure, feeling healthy, having adequate nutrition. All of those things are so important because it is the trajectory of well-being for our people and our children as they go into society.
Our women are subjected to racism and stereotypes. They're treated with preconceived judgments. They're disrespected, and it all stems back to racism.
So as a young Indigenous woman, and my partner is Anishinaabe, being pregnant, when I had my second child, unfortunately, in my experience, there wasn't as much focus on how I wanted to deliver or what was my choice or my plan in delivery. I remember being induced and being pressured to take the next step in induction multiple times. I was confused because I thought I was clear enough in my answer, no, I'll just wait as long as the baby's fine. So I stayed in that space, but it took me a while to reclaim what I wanted. So it's always important to remember that women that are with child and going to birth their child, that they have that inherent power that's inherent to them. And that power should never, it's inappropriate and harmful to take that power away from them in their choice in what they want.
When I have my baby, I was pregnant for 9 months, and I came to Lynn Lake. I want to see the doctor because I feel pain. But the doctor said, this is the only time you have to go. Well, I said no. But honest, I said no, I can't go, I feel sick. And he said, you have to go. Well, I went on a train from Lynn Lake, was supposed to go to the park. And at around 5 o'clock in the morning, I feel more pain. Sure enough, I had my baby. It was a baby boy. His name is Angus. And I don't know why they do that to Native people, If I have a home there, I won't come. There's a hospital there, I won't come. I had nobody there. I didn't even have an escort, and I have to go.
In this journey of supporting women, we've witnessed a lot of injustices within the healthcare system. Even if they don't have a birth alert issued through CFS, The nurses in the hospitals will phone agencies to see, just to double check. And it's just the most racist and violating act that a healthcare provider could do to a woman in the most precious time of her life.
When my sister was pregnant, this is before I got pregnant, she went to go see a doctor, and this was her first time, and I had no idea, so I was just supporting her through it out. But from what I saw with her doctor, there wasn't a connection with her and her patient. She wasn't trying to get to know my sister or understand her or sympathize that this was her first time, and she wasn't understanding of a lot.
When you're going through a process, a system where you encounter, yeah, well, you know what, you're pregnant, but you probably drank. You know, there's a lot of racism that is so unnecessary that many of our women encounter.
And when you begin to see stereotypes within, say, a unit or a hospital, or when you start having stereotypes and you believe people are making it that way for themselves, then you become prejudiced and you begin to give discriminatory care. So the care is different. So when you start to see that, it becomes so normalized that people don't recognize and pause and even talk to each other about the care that's being provided. So then you see a system that becomes sick, and that's a structural racism or systemic racism.
Healthcare is really not a good word in that health system, because the care doesn't always go into it. And there's a lot of racism that goes on when nurses are talking to our young women. A lot of them are mistreated again because those nurses and those doctors don't know the value of that young woman.
As a nurse and providing care, it's about building and maintaining that relationship with another human, connecting with another human. Often though, sometimes as nurses, we're very task-orientated, so we sometimes have our tasks that we need to complete without considering what the client needs in that moment.
So you have to recognize that when someone comes to you for care, that they're trusting or they're trying to trust. And that's I think the most important thing is the relationship that a nurse or a provider has with their client. It's fundamental to actually having support and to achieving good health. So as a provider, we have the responsibility to take a look at what's not working and how do we support the client so that they can in fact adhere to their treatment, or in fact lead to better health outcomes.
Healthcare providers need to be very cautious of their interaction with our First Nations women. They remember everything that is said to them, that every look that was given to them, or every option that was given to them. They remember these things, whether as a healthcare provider that you don't think that they're going to understand. Our women do understand.
They do want to feel cared for, and they want to feel heard, and they want to feel supported, because it's not very often that they're familiar with the urban life. They're used to their small community, their family, their friends, and their aunts and uncles, and coming out here by yourself gets extremely lonely and just doesn't feel good. And when you're pregnant, you should be enjoying every second with it, and it's good for you and your child.
We need to make sure that however women want to be supported, they can be supported. And that means accommodating the patient. That doesn't mean accommodating the system.
Well, I think they could not try so hard to force like the epidural, the morphine, the gas. And that's something they push on you. Yeah, like if you tell them no, you don't want it, they still continue to ask you multiple times. Like with my first daughter, I was saying no, I don't know how many times, and then I finally agreed, okay, I'll take it. And then it didn't help. Like, you know, if somebody says no, that to accept their answer.
We have to have, you know, women being able to give birth in their communities, with their families, without being separated from their other children, without being separated from the fathers and their supports, the other women in their families, you know, being treated with respect, being spoken to in their own language, you know, so that they understand what's being said, what's being done.
Cultural safety would look like respect for our practices, and really create an environment of trust, because that's what's missing. People talk about the vulnerability of Indigenous women, but we see Indigenous women as the strongest beings on Mother Earth. They're co-creators. They work with Creator to bring new life. And that's why it's so important that we surround them with love and compassion and respect, especially when they're bringing children into this world.
Thank you.